up, guys? Dr. Dan over here at Turack Chiropractic. Wanted to shoot a quick video on some of the infant care that we do here in the office. One thing as a new parent that you have to be aware of is the position that your baby sits in, sleeps in, basically lays in, right? So as a chiropractor, we primarily teach people how to take care of their spine so that they can feel good. And a lot of times we'll see parents in here that have new children, new babies, whether they're a week old or a month old or even a year old. And one thing that I always educate parents on, pay attention to the way that your baby is sitting, whether it's in the car seat, on his or her back while he or she's laying there. Pay attention to the way that their neck and their torso lays in, because many times early signs of torticollis, neck strain, shoulder problems, we can pick those things out when a baby is a day old, 2 days old. As they grow throughout the week and the month, if you notice that your baby is constantly tilted or twisted in one direction, that is an indication that something is going on in their spine, in their torso, whether it might be a joint restriction, some kind of spinal issue, or even an abdominal strain or a muscular strain from the way that the baby was possibly delivered, or an early injury that occurred from picking the baby up or anything like that. They're fragile, but they can absolutely be worked on, and we can help to reduce neck issues. One of the more common things that we see kids for, torticollis and neck strain, right? A lot of the times these issues are not picked out by pediatricians or treating physicians at the hospital due to they just don't see the progression of the baby, right? So a lot of kids nowadays are ending up with these flat heads where they might require a helmet at, right? So as a chiropractor, we see these kids weeks on and weeks out where their head might be twisted. We tell the parents, hey, that baby is likely going to develop a flat spot on the back of his head due to the inability of the neck to move or bend or twist in any direction, right? So, major tip, pay attention to your children, make sure that they're able to turn their head through a full range of motion and that they're not always laying with their head turned or twisted to one side. That is an indication that there is something going on, whether it's a strained muscle, a joint problem, something going on either in their neck, their upper back, or even down in their lower back or their hips or their pelvis. Just like you as an adult might have back pain or neck pain, kids also get the same aches and pains. They just can't verbalize it yet. So we always say babies cry for 3 reasons. 1, they're tired, they're hungry, or they're in pain because they might not be able to turn their neck and look fully each direction. Chiropractic care can help out with that significantly. We'll shoot some future videos on how we work with infants here in the office, but pay attention to that. If your child is having issues turning his head, or if you notice that they are getting a little flat spot in the back of the head due to inability to rotate, call our office, because we see a lot of infants, whether you're a day old, a week old, or up until, I think our oldest patient now is 95 years old. So chiropractic care works for everybody. Everybody has the same spine. They're just smaller and little guys. And obviously we want to grow up nice and healthy, strong and straight, right? We want to get that spine nice and healthy so that we don't have aches, pains, shoulder problems, all the bad stuff. We'll see you guys on future videos. Dr. Dan at Turack Chiropractic. Look us up on Facebook, Instagram, or give our office a call at 724-940-3499, and we'll see you guys on future videos.